Welcome back. Joining us now is Erin Marie Olszewski. If I pronounced your last name correctly, Erin, thank you for
Yeah,
joining us. Did I
yeah,
get your last name correct?
it's good. You did
Okay.
really well. Thank you
Pretty
for having
close,
me.
huh?
Yeah.
Okay. All right, we'll go with that. Of course, as we were establishing contact during the break, Aaron had heard those people in New York, the combat veteran, and what he was saying about that. And of course, Aaron, you're an Army combat veteran. You pointed that out to me. You said you feel the same way about this removal of our freedom.
Yeah, absolutely. It's it's kind of a slap in the face for those of us who, served overseas fighting for
Yes.
our country's freedoms. And, now here we are on our own soil, essentially doing the same thing. So
Yes.
yeah, I definitely feel the same way about having to continue fighting for something that should be ours, you know.
And a key thing here is that you've written a book, Undercover Epicenter Nurse, because you were a nurse right there in New York City at the epicenter, the world epicenter of this thing. And you saw a lot of things that disturbed you a great deal
Mhm.
about lying by the media, lying by the government, medical practices that are happening there. And as you started to see these things and you were concerned about it, you started doing some undercover recording of this, and you've now written a book. The book is Undercover Epicenter Nurse. Tell us a little bit about the hospitals and what it was like at the very beginning of all of this.
Yeah, well, I'm originally from Florida. That's where I live. And, I was working in a hospital here, and we weren't seeing the same thing that New York was seeing. So it was really confusing. A lot of us were furloughed. We were looking for hours, we weren't seeing the patients. And,
Hmm.
an opportunity presented itself for me to travel to New York, during the height of this pandemic. So I took it. And
So you wanted to help out. And
yeah.
there were people, and let me just interject here, because when we were covering the demonstrations in Raleigh, North Carolina, there was a nurse, and she said, every year, this time of year, we typically have like 110% occupancy. And as she's talking, she says, there you go. I've had my hours reduced. I just had the head nurse send me a thing asking if I could give up some hours this week because they don't need me. She goes, how is this happening in the middle of a pandemic that we need to lock everything down here in North Carolina? So you saw the same thing in Florida. You heard that New York was the epicenter, so you go there to volunteer. What did you see?
Well, this wouldn't be the first time that I'm heading into like a quote war zone. They're calling it the front lines. So I got off the
Hmm.
plane and we sat around for 3 days looking, waiting for work. So that was kind of my first red flag. There was nurses that were there, ahead of me that were sitting around for up to 3 weeks. So in a pandemic war zone type of situation, you would think that all the staff would be utilized. So that wasn't happening.
Hmm.
Once I finally did get my assignment, I was assigned to Elmhurst Hospital, which was the epicenter of the epicenter, I guess, in New York, the hardest hit hospital. And I was literally there for one shift, and I realized that it was the treatment. It was the treatment protocol. It was the fact that there is no families allowed in there, a liability-free environment. It was essentially a free-for-all, and people took advantage of that. And it's really sad because in my profession, we're supposed to care for our patients with ethics and compassion, and it just was all out the window. It was as if it was a lot of order followers just doing what they were told without really questioning why, and it was at the expense of patient lives.
Let me ask you, so you were there for how long before you really got essentially deployed to a busy hospital? Well, you mentioned it before.
In New York, I sat
Hmm.
for 3 days, getting
Wow.
paid, and
And
this
so
was.
then they send you to Elmhurst. And what was it like there? Was it chaotic? Was it overcrowded? What was it like there?
No, I really wasn't. I mean, pretty much every patient was on a ventilator.
Wow.
And they were just kind of in their rooms, just it was a one size fits all kind of thing. And it was
Hmm.
the overall assumption of most of the doctors and nurses that, well, they're going to die anyway. So what's the point?
I want to talk
And
about the ventilator
yeah,
thing, but I wanted to kind of focus on the lack of crowding, as you pointed out. Florida, and then also, we've had nurses say the same thing in North Carolina. There wasn't anything happening. You go there, you wait for 3 days, you go to the epicenter of the epicenter. And you said it's not overcrowded. We had all these media reports that it was overcrowded. When that happened, Aaron, I went back 2 or 3 years and I said, look at this. All these same hospitals are saying the same thing 2 or 3 years ago. Said, we got patients in the hallway. We need more beds. We need more money. We need all this. They were saying the same thing when there wasn't an epidemic. And as you pointed out, you said Samaritan's Purse was there. They weren't being used. They had the Comfort ship, the Navy hospital ship. President Trump sent 2,500 beds for an Army field hospital. There was also the Javits Center. None of that stuff was used. And the hospitals are not crowded. And you waited 3 days before you were even deployed to the Elmhurst hospital.
Yeah, I mean, even on a good day, these hospitals in New York, especially like through the health and hospital system, aren't very good hospitals. And I think this pandemic kind of brought light to the bad treatment already. And so the beds were full, but they didn't need to be. See, the thing with what was happening in New York, specifically at Elmhurst, is they were just admitting everybody and calling them COVID because there was a financial incentive to do that.
Yes.
And that was that I just couldn't let that go. For me, it's better if I have to lose everything to be able to expose something like this happening so it never happens again, then so be it. That's just feels like it's my duty as a nurse and just a human being to, bring light to this, because it's not fair to the American public to be lied to and have this fear of a virus that's actually not as deadly as they make it out to be.
You point out that you went in and pretty much everybody, it was a one size fits all. Everybody gets a standard treatment. You get put on an invasive ventilator. And as you point out, there's a big financial incentive for that. We mentioned that from the very beginning. $13,000 if you diagnose somebody as a COVID patient, $39,000 if you put them on the ventilator, plus then you collect for the treatment and so forth. And then we find out later on that there was a 25% bonus. We got the American Hospital Association saying, wait a minute, you're giving us to the Medicare people saying you're trying to pull back some of this 25% bonus, but you told us at the beginning of this that there weren't enough tests to go around and that the tests weren't very reliable anyway and didn't really work. So you told us to do clinical diagnoses. We did that, and now you're saying you don't want to pay us for this? So this is all a matter of record. What did you see? Because did they have tests that they at that point in time? What were they doing? Were they just doing a clinical diagnosis?
Yeah, they would do. We had the rapid tests were available, but they didn't use them because they were more expensive. So they would use the longer test that they have to send out. So 5 to 10 days in between the test and then finding out if the patient was COVID positive or not. So in the meantime, they would put these patients that were suspected. I mean, you could have like a cough, as if you had a cold, and you were called a COVID patient, and you were diagnosed as a COVID rule out, which is still a financial incentive to get put on the floor. And so we were seeing the majority of patients that didn't have COVID, but were put up in, COVID units and, waiting their test results, being treated as a COVID patient, eventually getting, stuffed into a vent and, carted
and
out.
I think people just didn't realize at the beginning of all this how dangerous the ventilators were. We now found out after the fact that about 80% of the people who were put on a ventilator died. Now, is that because only the people that got put on the ventilator were very advanced patients, or was it because it was a very dangerous procedure? What's your opinion?
Well, in March, Dr. Cameron Kyle Siddell came out. He was, an ICU doctor in New York, saying that ventilators were the wrong treatment. So I already was kind of looking at that. I thought it was interesting, continuing education for medical professionals. That's what we have to do, is just, continuously, keep researching what is the best treatment. And they knew at Elmhurst by the time I got there, which was mid-April, that ventilators were killing 99% of the patients. And I actually had reported a doctor stating that. So they knew that was the wrong treatment protocol, and they knew every single patient. Essentially, I think it was 100% when I got there, 99%. I think by the time I left, one patient survived. But they continued doing that because there was financial incentive to put them on the ventilator.
You diagnose them as COVID, you put them on a ventilator, immediately you got a profit. All right, let's go back to Aaron. Aaron, one of the things that that people need to understand is that this is treatable. As we're talking about the ventilators, and you had and you documented this really well. You went in with spy glasses and you recorded this. So this is not just you testifying about what you heard in terms of your credibility. Now you've actually got this on videotape, and you've got the transcripts in the book of what you recorded. You pointed out one doctor said 99% of the people that they put on ventilators died. What was your experience when you treated patients in Florida with HCQ?
We had 100% success rate.
Wow.
Our governor didn't ban medication that saved lives, and that's a big deal. And that's one of the things that you see across the United States and many of the blue states is the governors got in between the doctor-patient relationship, and that should never happen. And that is where we saw the most deaths in most of those states where they banned treatment protocols. So you have
That's
to
just amazing. You have one treatment protocol, the ventilator, nearly 100%, 99% of the people die. And then with HCQ, which is dirt cheap, this thing's been around for like 65 years, no patents on it. And that's exactly what the White Coat Summits were saying. They said, this is about money. This thing is treatable. There's a lot of different treatments out there for it. And yet they're holding that back, and they're pushing forward things that are very expensive, ineffective, or dangerous. Things like the ventilators, things like remdesivir. This is what is basically there. And people, I think the message of the White Coat Summits, and I think one of the things that your book is important because it puts out the side, your transcripts of what these doctors are saying underscores exactly what the White Coat Summits are saying. We don't have to be afraid of this. It is treatable. There's no reason for us to do this lockdown. This is simply about money. We're being played, and people need to be able to read those transcripts of what you recorded.
Well, exactly. And, a lot of these doctors, the frontline doctors, they saw the early treatment. It worked. The hydroxychloroquine zinc worked. I saw it too. I also saw the other side. I saw the side in New York where this treatment protocol was banned. And guess what happened? All of my patients died. So why? When is this okay to ever essentially just dispose of people at a price, and the price is their life. And I can only think that it's because they wanted the numbers up. They wanted the agenda pushed, and they wanted to be right. One thing that Cuomo did in New York was order 30,000 ventilators. So did he feel that he needed to use them to be right? I think so. I honestly, I do think so. And it ultimately, it cost a lot of lives, and it shut down our economy based on.
Well, all the politicians are pushing the ventilators. And again, they incentivize this. So if you just had one patient that you diagnose as COVID and you put them on the ventilator, this $50,000 machine, you immediately collect $52,000. And then you get to, as long as you can keep them alive and treating them, you get to collect for the usage of it and the hospital bed and all this other kind of stuff. I mean, it was a massive cash machine. The politicians got in here, started practicing medicine. They didn't know what the ventilators were about. They were browbeating various companies because, like Ford, you aren't producing enough ventilators and so forth. And now we have the same thing that's about to happen with a vaccine. You got the politicians practicing medicine. Nothing is allowed other than the vaccine, just like we've seen at the first round of this in the spring. Everything else had to be shut down. And we had a lot of people talking about, well, we got stem cell treatments that worked in Wuhan. We got intravenous vitamin C. We got a doctor who said, hey, steroids seem to work, so let's use that. Just use it as an inhaler. That'll get it right to the source. All of that stuff was pushed aside. You had the government stockpiling massive amounts of hydroxychloroquine. They still haven't released that. And yet what they do is they push these ineffective, dangerous, expensive treatments, and now they're going to push the vaccines. I mean, what do you think about that in terms of the Operation Warp Speed?
I think that it's going to cause mass casualties. I honestly do. I mean, there's a GoFundMe out for a woman right now who's in the trial, and she, is losing her life right now. So why do we need a vaccine for a virus with a 99.7%, if not greater, recovery rate? And why aren't they discussing our immune system? What can we do to keep ourselves healthy? I mean, that's just not a conversation that they want to have. So why? Why not? And that should be a red flag for everybody. Yes. They're putting masks on people. Those aren't, as a nurse, I have to be professionally fitted,
Hmm.
in a mask, and you have to know how to professionally wear it. They're just really pushing